Healthcare in Long Beach. Dr. Bhatia, can you tell us a little bit about what women can expect when they come here?
This is a very comprehensive center for women with problems of prolapse, problems of incontinence, and we individualize the approach for each and every patient, because it's not that one kind of treatment fits all.
Right, okay.
So we go into the details of patient's history, background, what they have done so far, and what's the optimal management for their current situations.
So you cater specifically to every woman in an individual way?
Exactly,
yeah.
Because we try to customize and individualize as to what's the best option for that particular patient.
And what are the options available for women with pelvic prolapse?
Yes, it's a very good question. Things have evolved over the last, I'll say, 3 decades. The various options available, from non-surgical to surgical, various kind of pharmacological, we call it, or various drugs available. But primarily patients who have urgency, incontinence problems, drugs are always the first option. There are various kinds available, and one can try different ones depending on one's symptomatology. There are also some prosthetic devices available which we can use to manage prolapse and incontinence some of these patients. Physiotherapy, exercises, all those depending on one's need and what kind of issues they have. And then surgery has also evolved over the time from major surgical procedures to much less invasive procedures now. And depending on one's a combination of prolapse or incontinence or what have they done before and how the tissues are based on our exams and various studies we do, we can offer a variety of different surgical options as to best suitable for that particular patient.
Wow, so there's a whole variety of options that are available for women, so they don't have to think that it's just surgery or just, medication.
Exactly. So it's really, you have to individualize for each patient who comes in.
And what is your particular background on this subject? How long have you been in this area?
It just feels like I've been too long at times. Almost for the last 35 years. Wow. I have seen this field of urogynecology, prolapse, incontinence, has made tremendous progress over the years. And fortunately, I've been a part of that. Right. We have done extensive research. We published a lot in various books, journals, our research findings. And we are still very actively involved in looking into as to how can we help patients in a more efficient and a more least invasive way.
Yes.
So things are gotten much better. Still, there are a lot to be done. But
ongoing research, yes, of
we're
course.
making quite a bit of progress. The latest being looking at the stem cell research as to how it can help the pelvic floor in incontinence.
Very good. Well, you have a lovely ambiance here at the healthcare, and it's really great and very interesting to know all that information. Thank you, Dr. Bhatia.
Thank you very much.